Should you be scared to get pancreatitis after a colonoscopy? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got the beautiful Tina Nunziato sitting right here by my side. If you're watching us on YouTube, you can see us both. If not, you're listening to us, awesome. We are just excited and thrilled that you are joining us. If you're a first-time listener, welcome. And if you're one of our regular listeners, we love you, and we thank you for continuing to be on this journey with us. We've been on this journey for over 10 years. We've been podcasting. We have hundreds of episodes out there in our podcast library, so please check it out. A lot of great information, and it's all still pertinent. Alrighty, so should you be scared of getting pancreatitis after a colonoscopy? What do you think, Tina?
Well, I didn't even know it was an issue until we had posted our colonoscopy podcast a few weeks ago, because March is, colonoscopy awareness month. So we always podcast on get your colonoscopy in March. And we have had a lot of people on YouTube that are commenting on our videos. And so one of the comments was from someone who brought up it wasn't actually that recent. It was back in 2022, I guess. The Travis Barker, who's married to one of the Kardashians, he's the drummer on Blink-182. He apparently got pancreatitis post-colonoscopy, and they blamed it on the colonoscopy. And so she had mentioned that she's been nervous to get a colonoscopy because of that.
Okay, all right.
And so I didn't even hear about that back, this is like 3 years ago now. So anyway, we were doing some research on him and kind of what happened to him, because it is very rare. And so I wanted to do a podcast on it with you, so that, because look, I feel like everyone makes excuses why not to have a colonoscopy. Okay? And we need to talk about these excuses.
Listen, first of all.
Listen, Linda.
First of all, I had never heard of pancreatitis being a complication of a colonoscopy until this. So actually, I was very excited to do a little bit of research on it. I mean, I'm always open to learning something new. I will tell you that I have been doing this for 25 years. Actually, gastroenterology, yes, because I started my gastroenterology training in 2000. And the first day that we started, we had a scope in our hands, okay? So I've been doing this now 25 years. And knock on wood, I have never had a pancreatitis complication. And it's not because I only do a few of these a day, okay? Because I mean,
you do
thousands.
About 3,000 a year.
3,000 a year. So definitely, I definitely do a lot of these. And have I had complications? Yes, of course. If any gastroenterologist ever tells you they've never had a complication, then they've either not done enough or they're lying, okay? Because it's just part of the territory of what we do. And we're human operators, and stuff happens, okay? I mean, not that you ever intentionally set out to have a complication. I mean, it just happens. When you go driving your car, you don't intend to get into an accident, but things happen. And so the most common complications with a colonoscopy are bleeding, perforation, and also cardiac and respiratory complications that can potentially occur with anesthesia, with a sedation. Okay, I mean, that can happen. I would say those are the most common complications. Then there's complications that can occur with the spleen. All right, the spleen sits in the left upper part of your abdomen, and the colon, there's a ligament that connects the spleen to the colon. And so with passing the camera, sometimes you can have traction just with passing the camera in that area, in that turn, that can cause tugging of that ligament, and with tugging can cause laceration to the spleen. You could get lacerations, a significant bleed. So definitely splenic laceration, splenic trauma, spleen trauma is a complication that can occur. All right. It's definitely not as common as some of the other ones I already mentioned, but it's definitely one that, coming out of training, we were well aware that that was a potential complication. However, pancreatitis, I have to tell you, that is not a complication that we were ever even taught about in training, because it's not like I came out of training being aware that you could develop pancreatitis. And when Tina told me about this comment that we got, I was like, what? I have never heard of that. And so sure enough, I looked it up. And what I found out there was that it's very rare, very, very rare. So the tail of the pancreas, the pancreas runs across your upper abdomen, sitting down low in the abdomen, and in fact below the stomach. But the tail runs close to the area of the spleen. So perhaps you could get some trauma to it, maybe from pressure, maybe from putting air into the colon, because when we go into the colon to do a colonoscopy, we fill it up with air or CO2 to distend it so that we can get a good look. And so possibly maybe some pressure trauma from distending it, and the tail of the pancreas sitting close to the spleen area, and we're going through that area. Maybe that. Maybe some trauma from pressure. Sometimes when we're doing a colonoscopy, sometimes the camera starts to loop, where it's just looping up in one place and not really advancing through the colon. And so sometimes we have to get the tech, ask the tech to give us some abdominal pressure, and which is where they take their hands and they manually compress or press on the abdomen to try to keep the scope from looping up, so that we can it'll actually advance through the colon. Does that make sense?
Yes.
So maybe from manual pressure, use it from the hands. I mean, I don't know. Look, I use a lot of, I have the techs help me out a lot. If I start looping up, I have asked the tech to give me manual pressure, and, on hundreds and hundreds of cases. And knock on wood, I have never had a case of pancreatitis. So definitely something very, very rare, and definitely something that I would not use as something to keep me from having a colonoscopy, okay? Because it's such a rare thing, okay, from what I read. I mean, like I said, you've got bleeding, perforation, laceration of the spleen, complications with the sedation, respiratory, cardiac. Those are much more common complications, and even those are rare.
So that's what I want to talk about. Even the ones that are at the top of the list, that I know you mention to patients all the time. They sign their waiver, saying that they could have these things. You have out of 3,000 cases a year, you even have very rare complications of those.
Yes.
So talk about that a little bit, because, you kind of like, these are the main things that could cause, but even those are rare.
Even those are rare. And, I think that, look, like I said, I've been doing this over 20 years. So there's something to be said for experience also, okay? Through the years, things that have happened, I've modified here and there. Nothing major. I'm still doing the colonoscopy the way I was taught. But, for example, I will throw this out there. At the beginning, it was almost like a sign of weakness if you had to ask the tech to help you put pressure. Like if you couldn't get that camera through all the way to the end without asking for help, if you had to ask for help, it was almost like this stigma of a sign of weakness. And I remember specifically having a couple of the older docs tell me, oh, I've never had to ask for help. That's just, that's weakness, and so I just remember that was like in the back of my head. But then as I went through, as I started practicing, and I did have some complications of a splenic laceration, and that was early on in my career. And it traumatized me so much. And I specifically could remember that those were cases where I did have, one of them in particular, it was a very tough colon. There was a lot of looping, had a very difficult time passing the camera through. I can't remember off the top of my head if I asked for help, but I do remember having that stigma in the back of my head of, if I ask for help, that's a sign of weakness. I should be able to do this. I tell you, after having certain complications, there are just things that you do differently. And it's not that I was doing something wrong before or that I intended to do, it's not that I was doing anything wrong. It's just that you do modify some stuff. I said, forget this ridiculous stigma of it's a sign of weakness. I don't care. Anybody could think I'm weak, but if I'm starting to loop and the camera is looping for the patient, just to help me get through and so that I'm not tugging at that colon on that patient with the looping, I'm going to ask for help.
Yeah, I mean, you think that for the patient's safety's sake, that it's not an act of weakness, it's you trying to keep the patient safe.
Exactly. But you know what? We all go through training, and there are a lot of things that are said through training. Yeah. I mean, I can still hear in the back of my head one of the attendings telling me to biopsy better. Well, I wasn't biopsying bad. It's just that the colon was moving and I was trying to be safe about it and not put the biopsy forceps through. But that attending was very impatient, very like, hurry up, we got to get out of here. And you need to learn how to biopsy better. Just things like that are just said.
It's like traumatizing.
Yeah, it's traumatizing because now you're like, oh my goodness, I better learn how to biopsy better. Well, it turns out I was biopsying okay. I was just trying to keep careful. The patient and be extra careful. And with experience and through time, you get better at anything you do. I mean, that book, The Outliers? Yes. It talks about
10,000
10,000. 10,000, and so yes, with experience, it gets, you get better on several levels, and we could do a podcast on that in itself. But the complications of bleeding, perforation, much more common, cardiac and respiratory complications with sedation, with anesthesia, much more common. However, having said that, rare. Okay, rare. I mean, like Tina said, doing 3,000 of these a year. And, knock on wood. I mean, this year, just in the past year, I don't even recall having a complication. I may have had one woman who went to the ER who had some bleeding, but that she ended up going home. She was fine. It stopped. They didn't have to.
Yeah, because sometimes when you take off a really big polyp or you... you may hit something when you take a biopsy.
Sure.
And then it bleeds. I mean, typically you're clipping in that area to stop it right away. But sometimes the clip will pop off, and sometimes the patient will bleed after they go home. But typically that heals on its own. And, it's not like a long-term thing. You don't need surgery, stuff like that. Those are more common. But
exactly.
Please don't let anything you hear sway you from getting your colonoscopy.
Yes. Okay? Look, a colonoscopy, I take it very serious. That patient has put their hands in my life. Their life in my hands. They've put their life in my hands, and I take that very serious, keeping them safe. However, it is considered a very safe procedure. Overall, it's a safe procedure. Patients overall do well, and please, like Tina said, don't let any of this information that's out there keep you from having a colonoscopy that can be life-saving, okay? Can be life-saving because we go in there, we find these polyps that we take off. Some of these polyps are precancerous, which means that if that polyp had been left there, had you not had a colonoscopy, over time, that will grow into a cancer, okay? No one should be being diagnosed with colon cancer. No one should be getting colon cancer anymore. We have this procedure that can be life-saving and that can prevent colon cancer. So please get your colonoscopy to whoever put a comment out there about the pancreatitis. Thank you so much for saying that, because I learned something new, and I want to reassure you, it is so rare. I've been doing this over 20 years, 25 years already, and knock on wood, doing thousands of these a year, and have not had a case of pancreatitis. So please get your colonoscopy done if you're due, if it's time and you haven't had it done, get it done. All right?
Yeah.
All right. Thank you so much for being on this. Please connect with us. If you want to schedule a free 30-minute wellness consult, go to our website, drlizcruz.com. There's a magenta color button on the homepage. You can click it and schedule a free 30-minute wellness consult. Can be done from anywhere in the world because it's done over the phone. And yes, it's free to you. If you haven't rated us, please rate us and please give us a 5. It'll help other people just like you to find us faster. And lastly, if you haven't subscribed, please subscribe so that you never miss an episode. Thank you so much for joining us, and we'll catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.